Well, we wanted to upgrade and benefit our patient care. I think we get better images. We expedite our process of when the patient checks in to when the patient walks out. Once you enter the patient into the system, shows up automatically right away. All the procedures are up there. Like for instance, if you do a chest x-ray, the PA and lateral are there. They automatically pop up. And you take the exposure and then it goes to the next one. And then you take the exposure and then it's all finished. You don't have to change the cassettes, that type thing like we used to. So, you know, you do a lumbar spine, the cassette stays there, you just position the patient, AP, lateral, spot, and away you go. We've always had a good relationship with Brown Medical in the past, and they answer our calls very quickly and come out and been very pleasant to work with.